Welcome to Kerosi TV. This is a platform where we share our ideas. We share with the world the solutions with policymakers that can help transform this world. We believe that we can lead to transformation of social lives, economic lives of people around the world, but including Kenya, where we are staying. So today we are going to give some practical solutions for making sure that the national government achieves its big four agenda, which is universal healthcare coverage. And we are going to give six smart ways in which the national government can use ICT or information communication technology to achieve universal healthcare coverage. The first way that we can use technology is to digitalize our health records. We know that once you go to an hospital, you get tested for various ailments. Those records are never made available to other healthcare centers or healthcare facilities. So if I get tested for cancer or malaria in one healthcare facility, for example at a national hospital, it is not likely that other national hospitals will find that information. So we end up getting tested several times, hence wasting our money, which we call out-of-pocket payments. But if we can digitalize the system, so that if I go to Mbagathi District Hospital, which is Mbagathi County Referral Hospital, I get tested for cancer or for malaria, those results should be accessed by all healthcare centers around the country. That way, we will be able to reduce the cost of provision of medical services to the people of Kenya. That is point number one. Point number two, universal healthcare can be achieved through use of ICT, and that's number two is through improving doctor community health volunteer communication. So with the use of ICT, we can have enhanced or improved communication between the doctor and the community health volunteer. That way, information will flow and healthcare will be provided well. Point number three is patient information. With use of technology, that is the ICT, one can access, or a patient can access this information from whichever part of this country. You don't have to walk around with notebooks or with those exercise books which are used to do prescription. But instead, you can always get your information on ICT equipment and be able to get your services in any part of this country, Kenya. Number four is that ICT can help in expanding or increasing the access to health insurance. For example, through having a portal where prospective patients can just open online and register to benefit from healthcare insurance. So healthcare insurance can become more accessible if we use ICT. Instead of us depending on face-to-face meetings where you have to go to the offices of healthcare insurance for you to get registered. We need to register everyone around the country online and remotely. Remotely, I mean you don't have to visit the offices. Just like the way we use M-Pesa, we can be using simple but efficient methods to register all Kenyans on insurance, that's health insurance. The fifth way of us improving universal healthcare coverage or achieving universal healthcare coverage is through patient-doctor communication. You see, if we had to progress economically and socially, we should have systems which enable us as patients or prospective patients to communicate with our doctors and nurses. That is, once I've visited the hospital, I've gone to the laboratory, they have tested me for malaria and other diseases, I should be able to get results on a mobile application, for example, so that I don't have to wait at the hospital to get the results. I can be doing other things, because some people go to the hospital even when they are not seriously sick, but they want maybe to conduct an annual health checkup or a semi-annual health checkup. Some people do it even on a quarterly basis. You don't have to be at the hospital for you to get the results. You can do this, the testing, then you go back to work and wait for results, which can be done on a mobile phone communication or other means of communication. Finally, there are smartphone applications which can be used to track, for example, blood sugar levels for people with diabetes, so that they can be able to know exactly at what time should they inject themselves with some doses of insulin. That way, we will be able to get advanced, we will be able to reduce the queues at our healthcare facilities, and hence, we will be able to become more efficient and provide universal health coverage. The same applications can also be used to check cholesterol, the amount of fats in blood, and also track the heartbeat, which is very, very important, so that people are not caught unawares when they do not know what's happening in their bodies. Through use of technology, that is ICT, information communication technology, we will be able to conquer the world. We will be able to join countries like Cuba in provision of universal health care coverage. Up to that point, I hope you have learned something, and you will communicate to your elected member of parliament that there is need for this country to invest more on ICT for us to achieve universal healthcare coverage. Thank you very much for tuning in to Kerosi TV.